Hi everyone, welcome to Ask Dr. Icon. My name is Dr. Lee Guek Eng and I'm a medical oncologist and I'm the Program Director for Young Women's Cancer Program in Icon. So today I will answer a few questions on breast cancer. The first question that came in is, can a lump be undetected by mammogram? So first of all, I will go into the general details like how a lump can be investigated. Primarily, a lump in the breast can be detected and investigated in a few ways and via a few modalities. The first way, which is most common, is using a mammogram. A mammogram is basically taking an X-ray picture of the breast. It can detect a breast mass as well as breast calcification. The second method is to use ultrasound. Ultrasound basically uses sound wave to detect for a mass in the breast and to differentiate between whether it's solid or whether it is fluid. Lastly, we can also use magnetic resonance imaging. Essentially, it is MRI, and what it does is that it uses high power magnetic field to detect for breast mass as well as details in the breast that can help us to elucidate whether it is cancerous. So with all this in mind, it's important to be vigilant and continue to do breast self-examination every month. If you do detect a breast mass, and despite a normal mammogram, it's time to highlight it to your oncologist or your doctor and even potentially request for further investigation if necessary. So let's come to the second question. The second question is, how do we reduce the risk of getting breast cancer? When we talk about risk factors for breast cancer, we like to differentiate it into modifiable risk factors versus non-modifiable risk factors because it then allows us to target what we can do to mitigate the risk factors of getting breast cancer via targeting the modifiable risk factors. So for modifiable risk factors, there are a few. The first primarily is sedentary lifestyle, obesity, alcohol consumption, smoking, and also taking hormones in the form of exogenous hormones such as oral contraceptive pills or hormone replacement therapy. Next, let's come to non-modifiable risk factors. Unfortunately, aging is associated with an increased risk of getting cancer in general. Being female is also predisposed to getting breast cancer. Certain race as well as family history such as BRCA1 and BRCA2 gene mutation is also associated with getting increased risk of breast cancer. Early menstruation and late menopause is also a predisposing factor. Lastly, chest irradiation at a young age also predisposes the individual to getting breast cancer later on in life. This concludes our 2 questions for today. If you all have more questions, please check out our website, and thank you for sending in those questions.